Welcome back to Sunrise as we continue this Hope Day Wednesday. Now, in our health slot today, we're looking at multiple sclerosis, which is an unpredictable, often disabling disease of the central nervous system. It interrupts the flow of information within the brain and between the brain and the body. Symptoms range from numbness and tingling to blindness and paralysis. Most people with MS are diagnosed between the ages of 20 and 50, with at least 2 to 3 times more women than men being diagnosed with this disease. To talk more, we are joined by Dr. Lerato Masemola. You at home can be part of our conversation this morning and ask, of course, some question a bit later on to the doctor on 011-447-1742 or 011-447-2570. Good morning to you, doctor, and thanks very much for joining us.
Hi, Penny.
Now, when we talk about multiple sclerosis, not firstly just the name itself is difficult to pronounce, and when you look at the symptoms, I mean, those are some of the things that people generally experience every now and again. So it kind of like, oh, you know, what does that mean? Do we know what exactly is multiple sclerosis and what causes it?
Well, in the name itself, multiple is many, so it can affect many sides of the body, and sclerosis is scarring. So it's an illness of the central nervous system, as you mentioned in your introduction of the illness. So the brain and the spinal column, you know, that's the central nervous system, and then it trickles down to the peripheral nerves. So that's what multiple sclerosis is the damage to the nerves of the brain, spinal column, and the peripheral nerves, and then a scar. So they no longer function properly. The messages don't get transmitted because it's interruption of flow from the scarred tissue.
What are the causes of that scarring?
There's no one specific cause, and over the years, nobody has come up and said this is what causes it, but many things have been pointed to as, you know, leading to multiple sclerosis. Genetic predisposition doesn't mean that you inherit it from your parents, but the makeup of a person may then predispose them to when something triggers it, then they can also then get it. So environmental factors, because it's been found to happen in areas where there's reduced sunlight or too far away from the equator, like, you know, more northern, like you go to Canada, there's more incidents there than, say, Central Africa. So, you know, where you live, your lifestyle choices, smoking affects it. Infectious causes have been pointed to lead into it or to trigger the immune system, because basically you have the lifestyle factors, which is the smoking, or where you live, how much exposure you have to vitamin D dietary-wise, and then your genetic predisposition, and something then triggers it. Then your immune response is what then inappropriately responds by damaging your own nerves, basically.
Okay, so the other thing as well, when we say it's, you know, between the ages of 20 and 50, and that women are more could be more affected.
Yeah.
Do we also know why is that?
That just points to the fact that, you know, that your makeup, you know, and then female versus male also goes to genetics. Yeah.
Okay, so now so we've talked about what is it and what are the causes. Now, you spoke about environmental factors. Does that mean that, I mean, how would I know that I could be exposed to that? Is it something that I can just catch? How does it actually work?
Well, people who are exposed to trace elements or industrial toxins are also more, the risks are higher. You know, so if there's anything that's going to be come into your body and then cause inflammation, and then your immune system has to respond to that, and then the response can be inappropriate and only attack your central nervous system. So, you know, if you have like chronic fatigue and pain and things like that, go and check and see if you don't have trace element exposure. A lot of us inhale lead from petrol fumes, and, you know, you go into a freshly painted house and you live there for a while, then that stuff from the paint, you know, you're inhaling it. So, you know, in the food, I mean, our food a lot of things get put in our food that we don't know what it is. So, you know, environmental factors allude to that, and also then the smoking and things like that. Secondary smoking, funny enough, also you can't discount it, you know, because the toxins from the smoke being in the fabrics and things like that can also then come into your body and affect you.
So can I come to you as my doctor and say, okay, what's, you know, I'd like a test to be done that I'm, you know, for multiple sclerosis. I mean, how does, I don't understand, like, how do you get to know? How do you check? Or is it one of those, like, after you've been not well for a while, and eventually they're like, oh, it looks like you have multiple sclerosis?
It would happen, with repeated symptoms, because sometimes it's very mild and all you might have is fatigue. But if you notice anything with, tremors or, incoordination, you want to do something and you can't, you take too long, the communication is too long, like, I want to pick up this cup, and you're looking at it, but you can't reach for it. Or you pick it up and you start shaking and things like that, and persistent symptoms. For most people, it's not going to come out clearing as, I woke up today and I started feeling like I got multiple sclerosis. And neurologists generally would have to do extensive CNS investigations and clinical examination to come to that diagnosis. There's no one blood test that's going to tell you you have multiple sclerosis. You might have high inflammatory markers, and nerve conduction tests might need to be done. But the patient history is what is going to lead to the doctor then actually doing a directed clinical examination to find that the central nervous system is actually quite affected.
Okay. So, the minute you start talking about the brain, and in the times that we're living in, people are, we're exposed to so much that we're having these illnesses that we knew nothing about, 5-10 years or so ago. Because fatigue is something that people experience on a daily basis. I was actually looking at some of the symptoms here. It just exhaustion. People are just like, we're living lifestyles that are exposing us to all sorts of things. Is there a way that I can prevent that I don't find myself in a situation where I'm dealing with the MS later on in life?
Okay, so you can't prevent yourself from getting infections that you don't know whether you're going to get them or not, because that could be one of the triggers. If you get like a very bad bacterial infection, some specific bacteria have been, pointed to say, okay, if you get chlamydia pneumonia, you might get MS, or if you have a history of that and you have MS, they might say, okay, that could have been the trigger to your immune response. So, but I mean, like I said, if you have chronic fatigue and you live in a city where you're exposed to heavy
like
metals,
Johannesburg,
to heavy metals, you
Yeah.
could go for regular detoxing and things like that. So, and also don't take up smoking, if you smoke, you can stop. That also reduces the risk. So you can only control lifestyle choices. And then a lot of people actually, we're all chronically deficient of vitamin D. We don't get enough from our diet. And we're all in the buildings. We don't get enough sunlight exposure. So low dose daily supplementation is not going to harm anybody. But there is a blood test you can check and see how low your vitamin D is. When I do vitamin D checks on patients, almost everybody comes back low. Or even if they're normal, it's at the low range of normal, not at the higher end where your vitamin D is functioning well.
Okay, so what is the impact of having low vitamin D?
Vitamin D does a lot of things in the body. It's almost like a mineral vitamin hormone kind of a thing. It's good for your bones. If you lack, you're going to get osteoporosis. It does help with nerve functioning. So that's why MS or multiple sclerosis, they talk a lot about the impact of vitamin D, and the areas where we say too far away from the equator, it's more prevalent because they don't get sunshine. Because sunshine is what actually activates your vitamin D to become active and then do what it's supposed to do in the body. So you need to ingest it or take it in, but you also need the combination of the ingestion and the sunlight to make it more.
Okay. Oh, well, it looks like most of the questions that, you've answered some of the questions that our viewers have, like PL here, PL to say, what is the multiple sclerosis and can it be treated? Okay, somebody wanted to know, is it fatal? Can I die from it?
You can die from it if, say, the nerves that are affected are the ones that help you to breathe. Then you can't breathe. Then you end up on a respirator, and then your family must decide, or you must decide beforehand, because you don't wake up and then you can't breathe. It's progressive. So you can get multiple sclerosis, which is primarily progressive, like it never really goes into remission or subsides. And you can get multiple sclerosis where they diagnose it, they give you treatment, and then it stops progressing or slows down drastically, and then it can flare up. So you get those two types basically. So you get the one which can be stopped by treatment but flares up now and then, or you get the one where it just goes on and on and on. So it can be fatal, especially in the primary progressive one, because then you're just basically waiting for your nerves, for the next stage of the nerves to get damaged, for the next stage of the nerves to get damaged.